Type 2 diabetes accounts for more than 90% of cases involving diabetes. In fact, approximately 350 million people in the world are diagnosed with it, about 28 million of which are in the United States. Most of the food people eat is turned into glucose, the body's main source of energy. Pancreatic beta cells secrete insulin, which is responsible for helping glucose enter the body's cells. In type 2 diabetes, individuals are insulin resistant, meaning that their body doesn't use the insulin as efficiently, leading to glucose buildup in the blood and therefore a rise in blood sugar. Genetics plays a large role in the development of type 2 diabetes, as does a sedentary lifestyle and poor diet. Specifically, type 2 diabetes tends to run in families, and being obese or overweight can contribute to the development as well. A high fat and carbohydrate diet, along with high blood pressure, are other potential causes. Smoking is another potential cause, as it makes diabetes hard to control, and smoking while having diabetes can lead to serious complications. Possible symptoms of type 2 diabetes include blurred vision, irritability, increased appetite, and nausea. One may also feel tired and have an increased need to urinate. One of the best things that someone who has been diagnosed with diabetes can do is to change their lifestyle. By changing their diet and increasing their activity level, individuals can lose weight, which in turn helps to make insulin more effective at doing its job, and therefore blood sugar levels are lowered more easily. Another possible treatment option is to use medication such as metformin, which helps to lower blood sugar and help repair the way in which your body uses food for energy. It also decreases the amount of sugar your liver makes and is absorbed by your stomach and intestines.
Our first nutrient is fiber. It's found in fruits, vegetables, whole grains, and legumes. Our research question is fiber beneficial in the treatment and management of diabetes? According to a study published by the Journal of Nutrition, fiber could be beneficial in the management of type 2 diabetes. Subjects were randomly sequenced to consume 4 different breakfasts, differing in glycemic index and fiber content, as detailed further on the slide. They had no knowledge of the nutritional content of each meal, nor did the researchers, making this a double-blind experiment. The insulin AUC was highest after consuming the HGI-LF breakfast and lowest after consuming the LGI-HF breakfast in patients with type 2 diabetes. Although combined with a glycemic index variable, this evidence supports the claim that an increase in fiber content promotes better control of blood glucose in individuals with type 2 diabetes. A study published by the Asia-Pacific Journal of Clinical Nutrition also suggests that fiber is an effective treatment. Subjects were randomized to be studied twice, once with an SDF liquid and again with an SDF-free liquid. The macronutrient content of the liquids were identical except for the soluble fiber content to avoid confounding results. The SDF drink decreased the postprandial plasma glucose and insulin in type 2 diabetes patients. Because the only variable in the nutritional content of the test drinks was the inclusion or exclusion of soluble fiber, this evidence indicates that fiber is effective in the control of blood glucose and insulin in individuals with type 2 diabetes.
This meta-analysis studies was carried out with total 15 trials. 5 trials were randomized control and 10 trials were randomized crossover trial. These trials use increased dietary fiber intake as a disease management strategies for diabetes mellitus 2. The result revealed that increased fiber intake was implicated to reduce fasting blood glucose and glycosylated hemoglobin in the treatment group. So they came up with the conclusion that fiber can be used as a dietary treatment for the diabetes mellitus type 2. In this study, a 12-month randomized controlled trial with 118 participants was studied to see the effect of dietary quality as a disease management strategy for diabetes mellitus type 1 and 2. Fruits and vegetables are a good source of fiber. This study showed that improving dietary quality with fruits and vegetable intake can reduce carotid intima media thickness progression, also diastolic blood pressure in the treatment group. It is known that carotid intima media thickness is a marker of subclinical atherosclerosis and predictor of cardiovascular disease. It is shown that patients with diabetes mellitus have accelerated atherosclerotic vascular disease. In conclusion, improving dietary quality can be used as disease management strategy as it reduces carotid intima media thickness progression.
All 4 fiber studies were well-conducted trials in which the overall evidence supported our hypothesis that fiber is beneficial in the treatment of diabetes. Therefore, we give fiber an overall grade of A.
Alpha-lipoic acid is present in most foods. It is created in animals where it is essential to aerobic respiration, but it is also found in spinach, broccoli, and yeast extracts. Although it's not readily available from dietary sources, it needs to be chemically synthesized when used as a dietary supplement. ALA is considered an antioxidant, which means it inhibits the oxidation of other molecules. Not much research has been done on it thus far. In this study, 80 subjects and 20 control subjects were given oral supplementation of 300 milligrams ALA daily for 3 months. The conclusion from this was that patients with type 1 diabetes who received the treatment had stable contrast sensitivity, whereas those who did not receive the treatment suffered significant deterioration. In patients with type 2 diabetes, they found that those who received the treatment actually showed enhancements in contrast sensitivity, whereas the other group did not. In this study, 90 patients with type 2 diabetes aged between 60 and 92, who had all been diagnosed between 10 months and 23 years prior, were made to take lifestyle changes, insulin, and platelet aggregation medications administered to be used as a control. They were then given ALA injections once daily for 3 weeks. The conclusion of this study was that plasma SOD and GSH-PX levels increased while MDA levels decreased. The difference of before and after values was statistically significant to a p-value of 0.01. The research concluded that ALA treatment can significantly reduce oxidative stress levels and lower hypoglycemic lipids.
Another clinical trial showing the effects of alpha-lipoic acid in type 2 diabetes was one in which the fasting glucose levels and HbA1c levels were measured after oral supplementation of ALA. The trial was completed over 6 months, with participants being split into 5 groups, which differed on the dosage of ALA taken, if any at all. The results showed a decrease in both fasting glucose levels and HbA1c following ALA supplementation.
These studies all received varying grades between A and C based on evidence provided. Therefore, there is not clear consensus of whether or not ALA is beneficial in the treatment of diabetes. We will give it an overall grade of a C.